Imagine your liver as the ultimate multitasking superhero inside you, quietly processing everything you eat and drink, filtering out toxins like a super-efficient cleanup crew, storing energy, producing vital proteins, and even helping regulate hormones and blood clotting. Day after day, it handles an incredible workload without ever asking for a break or complaining. But what if this silent guardian starts sending out distress signals through visible changes on your body? What if those subtle hints, like a yellowish tint in your eyes or unexplained itching, are cries for help that far too many people brush off as just tired or something I ate? Liver disease often creeps in slowly, earning its reputation as another silent condition much like kidney issues. Millions worldwide live with conditions such as hepatitis, cirrhosis, or non-alcoholic fatty liver disease without realizing it until serious damage has occurred. The exciting part? Many early-stage problems can improve dramatically or even reverse with simple lifestyle shifts, while catching advanced signs early can make all the difference in management and quality of life. In this comprehensive, doctor-explained guide, we will walk through the 10 visible signs of liver disease you can actually see or feel, expand with deeper scientific explanations from trusted sources like the Mayo Clinic, Cleveland Clinic, and Johns Hopkins Medicine, explore why each happens physiologically, discuss related conditions, risk factors, prevention strategies, when to seek urgent care, and hopeful steps toward better liver health. Knowledge is your best ally. Let's turn those whispers into clear understanding so you can act with confidence and care. What exactly is liver disease, and why does it matter? The liver is your largest internal organ, weighing about 3 pounds and performing over 500 essential functions. It metabolizes nutrients, detoxifies harmful substances, including alcohol and medications, produces bile for fat digestion, stores vitamins and glycogen for energy, synthesizes proteins like albumin and clotting factors, and regulates blood sugar and cholesterol. When damaged, through inflammation, scarring, fat buildup, or infection, its efficiency drops, leading to a cascade of symptoms. Liver disease includes acute issues, sudden, like from toxins, and chronic ones, gradual, like cirrhosis from long-term damage. Common types: viral hepatitis A, B, C, alcohol-related liver disease, non-alcoholic fatty liver disease, now often called metabolic dysfunction-associated steatotic liver disease, autoimmune conditions, and more. Early detection through blood tests, liver enzymes, bilirubin, imaging, ultrasound, or biopsy can prevent progression to irreversible cirrhosis, where scar tissue replaces healthy cells, impairing function and raising risks for liver failure, cancer, or portal hypertension complications. Now, let's break down the 10 visible signs in detail, with extra context on mechanisms, associated findings, and real-world implications. 1. Yellowing of the skin and eyes, jaundice. This is often the most striking and alarming visible change. Jaundice occurs when bilirubin, a yellow pigment from broken-down red blood cells, builds up in the blood because the liver cannot process and excrete it properly via bile. Normally, the liver conjugates bilirubin, makes it water-soluble, and sends it to the intestines. In damage from hepatitis, cirrhosis, or fatty liver, this pathway fails. You might notice it first in the whites of the eyes, sclera, then spreading to skin, mucous membranes, and nails. It can be harder to spot on darker skin tones, so check eyes closely. Accompanying signs: dark tea or cola-colored urine, bilirubin excreted by kidneys, and pale or clay-colored stools, lack of bile in intestines. Severe cases cause itching from bile salts in skin. Causes include viral hepatitis, blocked bile ducts, or end-stage cirrhosis. Urgent attention is needed if jaundice appears suddenly or with fever, abdominal pain, or confusion, could indicate acute liver failure. 2. Swelling in the abdomen, ascites. A distended, tight, or bloated belly without recent weight gain screams ascites, fluid accumulation in the peritoneal cavity. In advanced liver disease like cirrhosis, scar tissue blocks blood flow through the liver, portal hypertension, raising pressure in the portal vein. This forces fluid to leak from vessels into the abdomen. The belly may feel hard and shiny, with visible veins, caput medusae in severe cases. It can cause shortness of breath from diaphragm pressure or discomfort when lying flat. Ascites often signals decompensated cirrhosis and increases infection risk, spontaneous bacterial peritonitis. Doctors may drain fluid, paracentesis, and prescribe diuretics, but addressing the root liver issue is key. 3. Swelling in legs and ankles, edema. Similar to ascites but in lower extremities, edema results from low albumin, a protein made by the liver that maintains blood osmotic pressure. When albumin drops, fluid leaks into tissues, pooling in gravity-dependent areas like feet, ankles, and legs. Pressing leaves a pitting edema. This often pairs with ascites and chronic disease and worsens with salt intake. It can make walking heavy or shoes tight. Management includes elevating legs, compression stockings, and low-sodium diet, but it points to significant liver impairment. 4. Easy bruising and bleeding. The liver synthesizes most clotting factors, proteins like prothrombin, and regulates platelets. Damage reduces these, leading to prolonged bleeding, easy bruising, purplish patches, frequent nosebleeds, bleeding gums, or heavy periods. In advanced cases, it causes gastrointestinal bleeding from varices, enlarged veins in esophagus. This sign is serious. Monitor for black stools, digested blood, or vomiting blood, which require emergency care. 5. Persistent itching, pruritus. Whole body itching without rash, worse at night or on palms/soles, stems from bile salts depositing in skin when the liver cannot excrete them properly. It can be maddening and unresponsive to typical antihistamines. Common in cholestatic conditions, bile flow issues, like primary biliary cholangitis or advanced cirrhosis. Cool showers, moisturizers, and medications like cholestyramine help, but treat the underlying liver problem. 6. Dark urine. Even when well hydrated, urine turns dark brown or amber from excess bilirubin spilling over. This often accompanies jaundice and pale stools, the classic cholestatic triad. 7. Pale or clay-colored stool. While give stool its brown hue. Blocked flow from liver damage or duct issues results in light gray, putty-like, or clay-colored stools, often greasy and foul-smelling from undigested fats. Persistent changes warrant prompt evaluation as they signal bile obstruction. 8. Spider-like blood vessels on skin, spider angiomas. These red spots with radiating legs, like spiders, appear on face, neck, chest, or upper body due to elevated estrogen. Liver fails to metabolize hormones and altered blood flow. Common in cirrhosis, pressing the center blanches them. Multiple or enlarging ones indicate progression. 9. Red palms, palmar erythema. Bright red coloring on palms, especially thumb/little finger bases, from hormonal imbalances and vascular changes. Often bilateral and seen in chronic liver disease. 10. Confusion or personality changes, hepatic encephalopathy. A grave sign, toxin buildup, ammonia, crosses the blood-brain barrier, causing subtle issues, poor focus, sleep reversal, to severe confusion, mood swings, slurred speech, flapping tremor, hysterexis, disorientation, or coma. Graded from minimal, covert, to overt stages, grade 4 is coma. Triggers include infections or bleeding. Treatment, lactulose to reduce ammonia, antibiotics, and addressing precipitants. Who faces higher risk? Heavy alcohol use, obesity, especially abdominal fat, type 2 diabetes, high cholesterol/triglycerides, insulin resistance, viral hepatitis B/C, family history, long-term medications, or metabolic syndrome increase odds. Non-alcoholic fatty liver links strongly to these metabolic factors. Can liver disease be reversed? Yes, in early stages. Non-alcoholic fatty liver often improves with 5 to 10% weight loss through balanced diet, Mediterranean style, fruits, veggies, whole grains, healthy fats like olive oil, lean proteins, limited sugars/processed foods, and exercise, 150 to 300 minutes moderate aerobic weekly plus strength training. This reduces liver fat, inflammation, and fibrosis. Advanced cirrhosis is irreversible but manageable to slow progression and prevent complications. When to seek immediate care. Rush to emergency if severe jaundice, vomiting blood, black stools, rapid abdominal swelling, extreme confusion, or bleeding that won't stop. Your liver regenerates remarkably when supported early. Listen to its signals, adopt healthy habits, and consult a doctor for tests like liver function panels or ultrasound. You have the power to protect this vital organ and thrive.